Na pang negosyo di mo no. Ayaw di mo magsalig og SSS. Kay strong na kana. Ayun. Anyway, so today we'll be discussing the physiology of bones, okay? By the way, before na mag-start, kanang kuan. Kinsa ang pinagagahi na singer?
Singer?
Siya pinagagahi na singer. Nag-record mo? Nili, singer, sakto singer. Mag-band mo na sa Bon Jovi. Diba? The word boner actually applies to dogs and other mammals. Kaya nasa nila literally, nasa nila boner. Pero humans, horse, pigs, okay? So bones are very important. Do you agree?
Yes.
They say that in athletics, broken bones are not broken ribs, right? I think so. Anyway, so but before that, let's first define connective tissue. Before we discuss everything, connective tissue. By the way, that is a record.
Dok.
What record mo? Very important. Okay. So when you say connective tissue, by the way, nakabot naman na siya histola pa. Na pamani. So sila pero na. Very good. Anyway, so when we say connective tissue, it is a type of tissue where the cells are accompanied by a extracellular matrix. Okay? So dapat na yung cell and also an extracellular matrix. So the extracellular matrix with a cell is considered a connective tissue. But if you do not have that extracellular matrix, that is not considered connective tissue. Okay? So the most common connective tissue in the body are the bones. So for the bones, what is the extracellular matrix for the bones? It is the salts. The calcium and the phosphorus are the salts. They're salts. Okay? So they make up the connective tissue of the bone or the extracellular matrix. For cartilage, the collagen. Okay? So, di ba? Nainom mo, pag Pasko, ikaw ang humba, right? Sticky ang humba, right? That is because of the collagen. Labi na ka ng humba, medyo paanta, sagulan din na nila mga parts kanang sa hooves because it has collagen. Okay? So, ladies, if you're not looking young, like Doc Phil, mag-collagen mo. Okay? Contact me later. Like and subscribe. Joke. So, that collagen is actually made up of vitamin C, right? Mabita na lang game nun, kita direct pirates of the Caribbean. Kita mo, di ba? Kita mo sa mga pirate, mga batignaw? Yes. Pati yung nagnaw no, like, ilang kuan, ang uman pangag. Right?
Kuwang sa vitamin.
Yes, they lack vitamin C. Those pirates are suffering from scurvy. Yes. So, since wala sila vitamin C, wala sila connective tissue, so mo nang inanay lang mo. Okay? So, wala siya. That's scurvy. So, for cartilage, that is collagen. And for fats, some fats, the lipids itself. Okay? That is why in your vista, totoo na to ang adipose tissue sa animal, you will get fats. Because you are extracting the lipids, the extracellular matrix of the fat tissue from the rest of the meat. And of course, ligaments. By the way, what's the difference between a ligament and a cartilage? Wala mo ba?
Ay, ang ligaments eh. Sige ko na.
Di ba, we often interchange one from the other, but really what we call
Bone to bone.
bone to bone. Very
Ligaments.
good. Or, when you say ligament, it has something to do with ambulation. Okay, so movement of the limbs, the connection between a muscle and a bone is connected to another bone, or the muscle is connected to another bone, those are ligaments. Meaning they are more for ambulatory. They act as harnesses. More siya for binahon ba? Para malihog ka. Cartilage is for cushion. Okay, even your ears are considered cartilage. What wonder ka nila na yung ears? Because if example, si bako mo pagkainin mo, lampas yun na yung ears inyo ha? Tunggan, kay ing-ana-ana ang imong ears ang una igo. Okay? And in veterinary medicine, crumpled ears is an indication of certain diseases, especially the swine. Kita kayo mong swine na huwag ikumot yung dugan, something is wrong. Jiu-jitsu ears, yeah. Pero, yeah, sign na siya na mag-fighting ang animal because for cushioning dyan di imuhang ears. Okay? Because it's a form of cartilage. And other form, kasi may may cartilage yung hibuan? Nose, di ba? Like, magod na cartilage. Okay? So, any questions so far? Alright, questions. Let's continue. So, bones, connective tissue in a mineralized intracellular matrix. Very tough. We all know that the toughness of our bones is only second to enamel. Diba? Kahit yan ang bone, it's only second to enamel. Enamel is the hardest. Okay? Yes, kaya siya. Ako rin yung minutuman enamel nyo. Yes, it's an enamel. Okay? So, very tough. The extracellular matrix is composed of composite of calcium and phosphorus in a ratio of 2:1. Okay? Kung tayo sila sa ratio na, 2:1. So, functions provide structure and shape to the body. Of course, your shape is because of your bones, right? Like, diba? Some of us have Coca-Cola body, some of us have Coca-Cola in hand. Not trying to be judgmental, but that's just how things are. Okay? So, also students, they protect the delicate structures. So, for your head, the delicate structures is protected by your calvarium, or the vault of the skull. For your vital organs, lungs, and heart, thoracic cavity or thoracic cage. Thoracic cage, not cavity. For your reproductive system, pelvic cavity or the pelvic girdle. Diba? Ano siya? Pelvic cage. Then, of course, your spinal cord is protected by your spine. Diba? So, questions with that. What is long and hard and very useful when erect? Spine. Yeah, it's true. Very useful yung spine if barog siya. If dili gani, you know what will happen. Huh? Problems with the kababa mo students, the spine is so important that it's the first thing the body makes during embryology. Diba? Kung sa may first structure na i-form sa zygote. Diba? Ang primitive streak. That primitive streak will eventually become your kanang spinal cord. Inana siya ka-importante. Okay? And your vertebral column is so important that they can classify animals with or without it. Diba? There are two types of animals in the world. One with a vertebral column and the other with no vertebral column. Vertebrates and invertebrates. Okay, so also, there are hematopoietic sites. So it's not about rhymes and poems. Hematopoietic site is the reference to the ability to create blood cells. Okay? The blood cells are created by your bone marrow. Bone marrow na siya, ha? Okay? Diba, kita ng kwarta tagamay, makakautan kutsiro, lumigay bone marrow, right? It's fatty. It's just perfect. Right? So, okay, so ano siya? Then of course, it is a calcium reserve. Excess minerals in your calcium, or excess minerals in your body is stored in the form of bones. In the bones, they are innate, and they are in a storage form. That is why students, if you were to handle, mga kaning dairy, either goats, isa sa swine, if the animal is lactating, you need to give excess calcium. Yan naman. Because if you don't, that animal will suffer lameness. Very common in tanaman, very common in dairy cattle. That is why in dairy cattle, no legs, no cow. Because the moment you allow that animal to lactate, then mapial siya due to frailty of or loss of calcium, you are really shitty na bit. Meaning you're not really looking for sa diet. So namang welfare sa mga animals. Okay? So, babae mo sa nutrition now, what's the best source of calcium for dairy cattle? Nutrition. Yung formulation. Saan? Bone meal? Isa pa. Or crushed oyster shells. crushed oyster shells. Mao din na siya. Before, the best yun ana is kanang gitawag og calcium carbonate anakog. Pero they notice that dili man na siya mag-constipation ng katon. That's why in your nutrition, you are taught what are the most important sources of calcium. Okay, one is bone meal. Two is kanang crushed oyster shells. Oh, limestone ang usually lang before, but it's not really recommended. It's still there, but there are better alternatives. Okay? Very important. Types of bones. You have short bones, long bones, irregular bones, flat bones, and of course your special bones. So, kung ano naman, guys, din na kayo mag-discuss na what is a long bone, what is a short bone, what is a flat bone, or regular bone. Okay? Take note lang, in your flat, most of your bone marrow is actually found in your flat bones. If a bone marrow is sandwiched between two flat bones, that is what you call a diplom. Okay, so, common na siya. Usually, bone marrows are so important that they are sandwiched between two flat bones. That is the diplom. In young animals, you can find diplom in the skull, in the ribs, and parts of the pelvic cavity. Okay? So, that helps, excess bone marrow actually helps the animal create more blood cells for their growth. Okay? For adults, you can only find them in your long bones. Okay? So, nakapasan sa imong scapula but very rare. Hindi na kayo. Not like in a young animal. Okay? So, special bones of other animals such as cordis that is found in large ruminants. You also have your ospines in certain carnivores. Osteostriae in pigs or Swedish mga family. Okay, then of course pneumatic bones in avians. By the way, there's also the additional, nakalimot ko, remind me to tell the other classes. There's also the oscary. Oscary is common in raptor families. Na naman, that gives them their telescopic vision. Okay? Grabe ang ilang eyes na siya bone to fix the lens properly. Okay? Grabe na sila vision. Okay? Walang eyes na mahawk. Diba? Beastmaster, eyes na mahawk.
Search na ko niya.
Yes. So, going back to the physiology of the bones, this is the osteon, also known as the Habertian canal system. This is the functional unit of bone. Okay? It's not individual bone cells. You need osteons in order to create the functional unit of bone. Okay, what's the primary function of bone? Support. The osteon can do that. Store minerals. The osteon can do that. Can calcify things? The osteon can do that. That is why, in order, you don't need a cell, you need an osteon in order to create the functional unit of bone. Okay? Yes, this is one osteon. Okay, but we will not describe the parts na lang. That is for your histology. For now, I just want you to know that the functional unit of bone is the osteon. The osteocytes. Osteon. So, one osteon is made up of hundreds of osteocytes that function simultaneously. Okay? Any questions? Okay, so cells involved in bone function. Okay? So the generic cells in your bones are called your osteocytes. From the word osteo, meaning bones. Cytes, meaning cells. The primary cell in bone tissue, or bone structure. Osteoclast, the phagocytic cell present in bone, remodels the excess bone and releases calcium back. Okay? Back into the bloodstream, not into the cartilage. Please take note. Change this into what? Bloodstream. Okay? This one. Sorry, correct. Natubo na sila pag-iman. Okay. So, ano siyang guys, into the bloodstream. Those osteoclasts, from the word class, they are destructive. Okay? So, their job is to phagocytose parts of the osteon in order to release calcium back into the bloodstream. Okay? And they are heavily influenced by your parathyroid hormone. Parathyroid hormone. Right? The parathyroid hormone releases a hormone called parathyroid. Okay, so that is the one responsible for the reabsorption, activation of the osteoclast, which results in the reabsorption of bone. Okay, some say reabsorption, some say resorption, but the thought is there. The bone, the calcium from the bone reverts back to the calcium. Okay. Next, so meaning the osteoclasts are hypercalcemic in effect. They are hypercalcemic. Meaning if your osteoclasts are rapidly dividing, your blood calcium levels will start to go high. Mona guys, if your blood calcium levels are so high and the osteoclasts are active, you could have brittle bones. So, balik na natin sa baka. That's true. That the cow's bones can become so weak that its own weight could fracture it. So, diba? You're causing the animal to suffer. Okay? So, imbis na ikaw yung vet, ikaw dapat mag-make sure that the animal is not suffering. At ako lang mag-make sure sa calcium si Greg. Paano yung maka? Okay? Next is the osteoblast. It's the chief builder. By the way, if you hear the word blast, it is a builder or something that makes something, right? So the chief builder cell in bone remodels bone tissue from cartilage. So before mahihin mo ang bone, cartilage sa ano? Cartilage acts as a scaffold. You know what scaffold is? Alam mo, diba? Kita mo na mag-building ka, mag-construct building? Yeah, kato din, right? Naay mo rin mga structures that ato sa magbuhat ang mga tawag yung building before ka yung actual building. Those are called scaffolds. Okay, so, familiar din mo na scaffold, ka naman precursor sa building. Okay? So, before, the precursor for bones are your cartilage. Cartilage yun na before bone can start. Because, wala kong simento God, it takes time to harden bone. That is why cartilage sa before bones. Okay? When a bone is reabsorbed into the bloodstream, there will be an increase in serum calcium levels. That is the job of the osteoclast. The activities of bone cells are greatly influenced by the thyroid and the parathyroid. If the parathyroid has a hypercalcemic effect, what is the opposite of the parathyroid? So, the thyroid creates calcitonin. Okay? Calcitonin. Calcitonin is actually activates the osteoblast. And they also promote the reabsorption of calcium back into the bone. Meaning, if you example, you intake lots of calcium, your body has nowhere to put that excess calcium. There is an increase in your serum calcium levels. That will cause a negative feedback that forces the release of osteoblast that helps form the calcium or activate the osteoblast to increase the density of your bone. Okay? So students, your bones do not grow longer due to drinking milk. Your bones will grow stronger. It's not about length or height, it's about density. Okay? So kita naman ng movie, The Calcium Kid. Sige siya ginamong milk, kaya yung puting lahian. So, yeah, that's true. Okay? Any questions? Wala rin questions so far? So, ano siya? Compact bone and spongy calcareous bone. Okay, so, siya. Complex ka na. So, you will discuss more. You discuss this anatomy, right? So, okay na niya. Hindi na kayo mag-dwell on this. Okay? So, ang inyo lang bantayan is the periosteo and the nutrient line. Later, ako na discuss what is nutrient line. Okay? So, nutrition of the bone. Nutrient line is the bone receives blood directly from the nutrient line. This ensures that the bone recovers quickly from injuries. Okay, so what I would rather have broken bones than ripped cartilages. Ano naman? The bone has something called a nutrient line. The job of the nutrient line is to supply everything from the blood so that the bone can get everything it needs to function. That is the nutrient line. It nourishes the bones. That is why fractures could heal up to 3 weeks. Start to nag-heal yung fracture. Okay? While cartilage, ACL, cerebral, pila ka years na wa kay na-torn na yung ACL. Yung acute cruciate ligament. Tear. Kasi may basketball person na rin. Wala, dali ka masad ninyo eh. Bunch of nerds. Kidding. Kanang, kinsa man diri. Di ba, ka-notice mo, mga athletes, ma-tear ilang ligaments, tag 1 year mawa. Pero katong nabalik na diri na naana ang tiil, mga 6 months, balik naman sila. Ana-ana naman sila. Because bone heals faster than cartilage. Because of the nutrient line. But no, how do cartilages obtain nutrition or blood needed for their function? They obtain it through diffusion line. Meaning, the nutrients will go into the fluids of the body and it will diffuse into the cartilage. Okay? So, kung mo diffuse siya, diha kasad siya mo function. Okay? And kabaw mo guys, you need oxygen for bones, you need oxygen for cartilage. Nga naman, because those cells also have their own mitochondria. Okay? Wala na sila di na sila kaget ng oxygen, dili na sila maayo. That is why students, mga injured na athletes, if kinahanglan jud magdali, they are placed in a hyperbaric chamber. Yes. Kita mo na kagurag isod og capsule si Lebron. Yeah, basta you look it up, hyperbaric chamber. That hyperbaric chamber will promote the increase in pressure, making your blood carry more oxygen. More oxygen in the blood, more diffusion for the cartilage. So, magpas-pas can heal. Okay? Although in humans, in animals, wala pa kayo na, may kung magpiang ang horse, Thank you. So this is the bone. This is a long bone. So, your nutrient line, your nutrient artery, and these are the rest, shaft and everything. More on anatomy na ng mga parts, ha? Okay? The only thing you need to look here in physiology is you find the epiphyseal plates. And the epiphyseal plates, epiphyseal plates. By the way, nana kong pronounce para di mo makakuha ko sa spelling na epiphyseal plates. Okay. So, asa ka epiphyseal plates? And it's found on both ends of the bone. Okay? Nga naman. Why? Because the epiphyseal plates are called the growth apparatus of the bone. Okay? So, growth apparatus. So, your bones grow because of the presence of a structure called the epiphyseal plates. Commonly found in your long bones. Okay? Although most bones have it, if the bones have an epiphyseal plate, meaning that bone is capable of growth. Okay? Diba? Remember what I said about cartilage? That before bones can form, cartilage will be formed. As to name over first. The epiphyseal plate is made up of cartilage. And the great thing about cartilage is that it can stretch. And once ganun mo stretch na yung cartilage, it will become ossified. And of course, the stretching will increase the length of your bones. Okay? So for ladies, your epiphyseal plates will start growing or stretching but around 6 years old. And stop the moment you enter menarche. Dugo na gani mo or puberty, stop na sa growth sa inyo because the estrogen will actually decrease the function of the epiphyseal plates. Kung nakabantay mo ladies, inyong pagka 6 to 12 years old ninyo, most babies are taller than males, mga boys. Girls are taller than boys during that time. Okay? The opposite is for boys. For boys, you start growing during puberty. That testosterone actually increases your muscle bulk. That increase in muscle bulk will increase the pressure on your bones. Once getting more pressure on bones, of course, ma-stretch siya, right? I-stretch na niya, mo calcify na siya. That is why sudden kayo ang pagtubo sa laki. Di ba? You don't hear of females having growth spurs. But males, they direct. Nagadiroy pa lang na siya na rin. 15 yan, ano na siya nagadiroy, right? Especially if ang laki magsigig, dagan. Sige siya jump. Sige siya exert of force sa iyang bone. Ang taas na niya siya. Okay? Pilit, tulig na pilit. Ni-close na siya.
Ang tanda pa kayo ito.
Gusto man din tuloy. Ayun na ganaan, Dok. Wala na. Okay, for males, it opens during kanang puberty. It stops during around 21 years old.
Laitin.
Sabi mo gusto mo, tubo ka? O balik mo sa first year. So, gentlemen mo na. So, para rin fail mo na dyan yung height. Okay? Diba? So, ladies, if you're vertically challenged, it's too late na. Okay? Bisag maligo pa kag cherry fur, wala na yun siya. By the way, kumano mo kag cherry fur works? Usually, kabantay mo, laki yan sa cherry fur. It's actually just B vitamins with calcium. Aba mo ano? Mo inom mo B vitamins, ganahan mo mukhaon. Ganahan mo mukhaon, mubugat mo. Imubugat mo, more strain on the body in terms of gravity. Di ba? That is why murag mutubo ang bukas-pas yung tubo. If open may mong facial plate. Pero kung si Kuan, si tawagan si Greg, may inom nag-cherry fur, wala na nag-asa Greg. Sira na nahagbay na. Okay? So, Kuan, it's just a simple principle. Okay? Muna sa China, do you know how they surgically make males grow? Insecure mo ng mga Chinese about their heights. Okay? No, I'm not discriminating. Tinood na, sila mismo nag-ingon that in their society, the height of males is very important. Okay, that is why nagkuha sila procedure that ilang buko ng bones, surgically break this bone, then they try ilang wato na magka-cartilage na, then ika-cartilage na ilan ang hinahinayon o stretch para naghimo sila bone artificial plates. Yes? Then wala, mataas sila. Baya, ay ito, grabe ang mataas sila. Yes, sir. They most like artificial plates. Okay? So, Greg, ganaan mo.
Pwede ito na sa girl.
Yes, pero ang problem with girls is that by the start of your menarche, hantod sa ika-menopause ninyo, your estrogen actually maghilabot sa inyong facilitation. Mauna students, estrogen really throws a wrench in your development of your bones. Mauna, the moment ganit mawagtang na yung estrogen, mauna prone kayo to osteoporosis. Mauna, it's not advised to do it on females. Okay? Because kanang inyong estrogen is the only thing that's keeping your bones mineralized. Okay? The moment mawagi na yung estrogen, kanang inyong bones paon sa inyong body, ibutang sa inyong bloodstream. Sakto ba siya? Okay? The moment you're pregnant, hypercalcemia, produce of milk, wala estrogen in your blood. Okay? So, dili kayo kung familiar females. Usually, males will not usually mag-iwag. Okay? So, masama, laro Philip, nakita na.
Nakalimot ko ito. Hindi ko sa utok.
Oh, di ka katulog. Yes. Okay, so, ninong lagi mo na, insecure mo siya. Ayaw ka insecure sa yung height. Diba? Tanawang ka, every time may insecure mo sa yung height, always remember. Na Jedi Master, English Master Yoda, ikaw pa ka. Diba? 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 Kanawang mo sa kawan? Ni Master Yoda? Small I am, but the force is strong in me. Okay? So, mana, gentlemen, ayaw mo ka-insecure sa inyong height. Okay?
Ayaw pa insecure.
Ako pang kauban, bahala na, dili. Si Doc Phil, wala na ni grow upward, i-grow na ko forward. Anyway, so one has bones. Okay? So let's discuss fractures. Okay? A fracture refers to a break in the continuity of the bone. There are many types of fracture depending on severity. Okay, so a fracture is a break in the continuity of the bone. So in line, disruptions of continuity sa yung bone, for example, that's called a fracture. Okay? So, good. There are many types of fracture. So they have the grindstake, transverse, stress fracture, oblique, and of course the comminuted. By the way, it's the worst ano na type? The comminuted. Because the fracture is, the bone is separated into multiple pieces. Okay? So, kung fracture lang, wala ng oblique, even transverse fractures, pwede lang kasi bintungon. But, if ever ganit kuminutan yung fracture, wala yung makita na yung mga pins ng bone. Those pins are designed to keep the bone in place. Para mag-cartilage and mag-grow na sa tayo into bone. Okay, so, doy guys, right? Una, ayaw din mo kakan, ayaw din mo pag-kiat. Right? Like some people ay tatago natin sa pangalan Doc Phil. Okay? Kani akong bone, paano ba rin? 25 na ako pagkapian na rin. It's a form of blood. It's actually a complete fracture of my clavicles. Okay, so ang problema lang, my pectoralis muscle is always pulling my clavicle towards me. Magbutang yun siya strain as a muscle. So mana, pagkabalik yun sa clavicle, weight bearing ng clavicle, one siya. Pwede na na. Then, so ang ilang gibuhat, ilang realign ako, gimira nila ako kanin para mahugtong, align ko siya, gibutang nilang bone pin. Then, 6 months later, ilan na sa kitangtang ng bone pin. Then, yun na. Oh, by the way, pagkuha sa akong bone pin, wala yung anesthesia. Because if bad si SSS, para sa feel na, gentle mo. 25 na piya ako yung trabaho, so wala na akong feel. So, I opted not to be anesthetized during the removal of the bone. Halik naman. Okay? It's nice. Badass moments here, right? Like Chuck Norris moment, like anesthesia, what is that? Yes. Kung maputol ang bone, how about the nutrition line? Yes, maputol siya kami. Pero the body will find ways. Unlike your bones, your arteries are stretchable. Okay? Then, mula na sa siya sa surgery ninyo, di ba, nabuhilo siya? Of course, there will be angiogenesis. Ano sir, mag-expect diha yun? Okay, pero there will be angiogenesis. So, aside from the cartilage, of course, nasa na is time na mag-grow ang mga blood vessels. Okay? Unless, of course, clean off yun ang pagkagawa ng necrosis yung ka. Pero if ever kayo itukan, nasa siya connection, there will be angiogenesis. Okay? By the way, angiogenesis is the formation of new blood vessels. Okay, any questions? Lara? So, memorize natin nyo, magawa sa movie. Types of fracture. So, states of fracture healing. Okay? So, the states of fracture healing, you have your hematoma formation, soft callus formation, hard callus, and of course, bone remodeling. Okay? So, hematoma formation is also called the inflammatory phase. Okay? During this time, the 5 cardinal signs of inflammation will be present. About the 5 cardinal signs of inflammation: tumor, rubor, calor, dolor, and of course, no more.
Functionless.
No more function ba? No more. Okay, so I'm going to explain one by one. First, during the inflammation phase, there will be blood. The cells are destroyed, right? Some cells are destroyed, so we release cyclohexogenase type 1 that binds to the arachidonic acid. The arachidonic acid binds to the cyclohexogenase type 1, leading to the formation of prostaglandin that carefully binds into the pain receptors. giving you the sensation of pain. Very painful ang mga fracture. Pain. Next. There will also be release of histamine and other pro-inflammatory chemicals that increases the permeability of the cells in question. So, that increase in permeability allows the leaking of fluid into the area of injury, causing the tubor or the tube from the word tubul. Tubor. Swell ang area. Wala ko swell din siya. And of course, with the increase in swelling, there will be increase in blood flow. That increase in blood flow is what causes the calor. The calor is the increase in heat. Diba? Musaka ang circulation diha, blood is hotter than the rest of the body. So kung dagdag blood diha, that area will increase in temperature. That is increase in heat, that is calor. And of course, increase in blood flow also, blood is red. So increase in blood flow, that area will also become red. That is rubor, from the word ruby. So red siya. Okay? And of course, to make sure that the bone heals properly, the body makes sure that you should not move that area mo nagsakitan ka and everything. That is no more. So no more function for that. Kaya if ever gani, example, imong leg mabali sa bako. Mabali imong leg, then you try to put weight on it. Of course, hindi na siya maayo og tarong. That is why your body will tell you, oh, sige, butangin weight. Kaya it will hurt. It's gonna hurt like hell, John. So, maunang di sana siya mo function. And also some students, in some books, they tell you, because of the swelling, di ba, kung swell siya, kung siya mahugot, right? Para itnin mo malong-ilong ang area. Okay? Inanak, the body actually tries to heal you. Okay? So actually, ganit, ito kaya sila, mas nindot pa ang body yung heal, kaya hindi yan dyan. Okay? Even ako, kabantay mo, dili ko, murang kiwi maglakaw. Ano na resulta sa ito? Okay? So, ano siya? It's the one. Okay, so that is for the hematoma phase. After the hematoma phase, there should be a criteria before going to the soft callus phase. One, all the cellular debris need to be removed. Kumano naman sa yung immune, right? Si neutrophils, si basophil. Ano sila, they're not only for germs, but they're also for removing of dead cells, right? So, after the hematoma phase, there will be soft callus formation. Okay, so soft and callus. Okay? That soft callus is due to the osteoblastic activity. Osteoblastic. Not osteoblastic. Chondroblastic activity. Chondroblastic. Meaning, chondroblast from the formation of cartilage. The cartilage is actually the one that creates the soft callus. Callus is also named callio. Kailan mo callio? Kanan, if you do something, lamugahin yung kamot sa iyong feet, magkaw sa callio. Di ba? Callus. Lamugahin sa iyong kamot ba? May kung masawara na. Mga senoritas, hindi sila. Okay? So, yes, kubal. Kung saan ang lamig ikanon sa baboy, kubal. I don't know, ganun ganahan sila na. Kaya hindi mo siya nakubalo ng baboy, hayais trabaho sa baboy, magkaon matug. Puro na yung trabaho, wala nagpumay, kabaw ay lechona. Okay? Next is the hard callus formation. For the hard callus formation, the cells active are your chondroblasts. Meaning, in our bone and cartilage cannot occupy the same space. So the cartilage has to go and to be replaced with bones. That is the job of the chondroblast, and the formation of new bone cells, that is due to your osteoblast. Okay? That osteoblast will create hardening of the cartilage, resulting in the, so may tawagan na area, resulting in the hardness of the callus. That's why it's called hard callus. Nakuha pa niyo? Okay. Next, after that, there will be bone remodeling. So, as you can see, there will be excess hard materials, mga bones, once healed pa siya. The bones need to return to its original shape. So it is the job of the osteoclast to remove excess bones so that the bones of the limb can return to its original Kana original na shape. Okay, so osteoblast na siya. Osteoblast. Okay, any question? Wow. So, which phase of this is the animal more likely for the blood surrounding the tissue will become hypoglycemic? Hypocalcemic. Asa man ang phase? Soft callus. Dili. Hypocalcemic. Hard callus. Ito sa ang calcium sa blood. Diba? Hypercalcemic. Remotely. Yes. Leukocytosis. When does leukocytosis happen? What phase? Increase in the white blood cell count. Hematoma phase, because it's also a form of inflammatory phase. Any questions? Okay, so ako lang nag-discuss na. Any questions so far sa atong process? Okay, so memorize this by heart, ha? Especially the cells involved. Okay? Next, blood formation. Blood formation, blood is formed in the bone marrow located in the large bones of the femur. They're stimulated by different factors that will be discussed later. Later in 5, 4, 3, 2, 1. So, increase in RBC is due to the release of a substance called erythropoietin. Erythropoietin is released by what organ? The kidney. The kidney will release erythropoietin when it is exposed to hypoxic condition. Meaning, imulo gani ang oxygen level sa body, it prompts the kidney to release more erythropoietin. That erythropoietin will go into the bone marrow and will force the multipotent stem cell into forming mga red blood cells. Okay? Any questions so far? Okay, next is, dili naman red blood cells ang nasa bone. You also have white blood cells. So white blood cells, the release or leukocytosis or increase in white blood cell levels is released due to the immuno. So ba't yung makapinagdan siya white blood cells? Feel nila na punagan ng party sila. Rave. You're gonna go delta force of that infection. Then, cytokines or interleukins. Di ba? There's the word, it's called interleukins for a reason. Because once those pro-inflammatory chemicals are released, it prompts the bone marrow to create more white blood cells. Okay? Next is for the platelets. For the platelets, that is thrombopoiesis. Thrombopoiesis is due to the thrombopoietin. And the thrombopoietin is not yet known what forces the body to release thrombopoietin. But once it is released, it promotes the bone marrow to create more platelets. So makes megakaryocytes, release platelets. Okay? By the way, students, where can you find what creates the thrombopoietin? Your liver. Mga students, if your animal is suffering from liver failure, na ang platelet mo dahil. That is why, dili tanang exhibition ninyo, dili tanang mag-low ang platelet kay automatic na erlikyan na dahil. Okay? Sometimes liver problems can also lead to thrombocyte. The case is thrombocytitis or thrombocytopenia. Okay? Any questions so far? Wala na?
Ang liver daw, di ba, in an accident, break out na sa liver of heart disease.
Yeah. Actually, in an accident, your liver and your spleen can actually contract to provide your body with excess RBC. Okay, pero let's hope that doesn't happen. Okay? Dahil, baka ka nagkapalit sa body. Okay, maluya ka na for pila ka months. Okay, any questions? So, thank you. Let's have a short break.